Hi, I'm Dr. Suraj Chirania, hematologist and BMT physician practicing in Mumbai. Today we will discuss why bone marrow studies been done in multiple myeloma. What are the implications of doing the bone marrow test? So, multiple myeloma is a disease of bone marrow. Here in bone marrow, plasma cells turns to be cancerous. This plasma cell reside inside a bone marrow. In rare occurrence of plasma cell leukemia, they comes into the circulation. So to find out what are the exact percentage of plasma cells and whether they are defective or not, the bone marrow tests are must. Bone marrow test usually we do to test for four tests. First is bone marrow aspiration, second is bone marrow biopsy, third is flow cytometry, fourth is genetic testing such as karyotyping and fluorescent in situ hybridization, in short FISH testing. So how the bone marrow test been done? So bone marrow test is just like drawing the blood from the hip bone. Under the local anesthesia, 2% of lignocaine, we infiltrate the area with a circumference of 2 centimeter so that we can remove the blood from that area as well as take a tissue biopsy, means bone marrow biopsy from that area. Usually this procedure is painful, but for a minimal time. The pain mostly occur at the time of taking the sample of aspiration and taking out a biopsy sample. Post procedure, usually even if the local anesthesia effect wean off, usually there is no pain. If the pain happens to be, then it can subside with taking a simple analgesic like paracetamol. In this aspirate, we check first bone marrow aspirate testing. In that, we check the percentage of the plasma cells. If these plasma cells are more than 30%, sometimes more than 60% also. So whenever the plasma percentage is more than 30%, it points towards the active myeloma. Second, in bone marrow biopsy, whenever the bone marrow plasma cell percentage tends to be less than 30%, then sometimes the bone marrow biopsy can show the sheet of plasma cells and we can run immunohistochemistry test to check for the monoclonality. Third test is flow cytometry. Flow cytometry test will tell the abnormal plasma cell percentage and their monoclonality. Fourth, the most important are genetic tests. Genetic tests, what we do are two types. First is karyotype. Usually our body has 23 pairs of chromosomes. Then we see what are the defective chromosomes that gives rise to myeloma. Second genetic test which we do with the help of few special probes will called as FISH probe testing. So in that there are various translocation that gives rise to multiple myeloma like 414, 1416, 1420 translocation. The importance of these location translocation are to differentiate between the standard risk and higher risk, because there are different treatment guidelines for both the subset of patients while giving the induction therapy and maintenance therapy. So that's all for today's video on discussion regarding bone marrow testing in multiple myeloma. Till next, stay healthy, stay informed. Thank you.